Hi, how can I help you?
Hi, I'm here to pick up a prescription.
Okay, is it for you or for someone else?
It's actually for my son,
All right, and what's your son's name?
Seth Thompson.
Did you say Seth Thompson?
Yeah.
All right, well, my name's Robert Puishys. I'm actually the pharmacist who filled your son's prescription. So I just want to verify some information I have here for you. Are you still living at 25 Sheridan Ave in Dedham, Mass?
Yep.
All right, and what's your son's date of birth?
June 10th, 2011.
Perfect. And is your phone number still 617-555-6713?
Yep.
All right, excellent. So if you have a couple minutes, I'd actually like to explain some information about your son's medication to you. So do you have a couple minutes free?
Yeah, sure, that sounds great.
All right, perfect. So the first thing I want to talk about is some background information. So does your son have any allergies?
Nope.
None?
None.
Perfect. All right, so this medication could have some serious interactions with other drugs. So just to be safe, what other drugs is your son taking?
He's on acetaminophen for his teething pains, and he's also on Dimetap for congestion.
All right, so just the acetaminophen and the Dimetap?
Yep.
All right, perfect. And is he taking any herbal medications or vitamins?
Oh, he's actually on multivitamins. He
All
takes
right.
them once a day.
So just one multivitamin?
Yeah.
All right. The last thing I'd like to know is, does your son have any conditions other than the ear infection that
Nope.
this medication's for?
No, that's it.
All right, good. So the next thing I want to talk about is your son's prescription. Do you actually know what medication you're here to pick up today?
I think it's an antibiotic.
Yeah, it's actually for his ear infection. It's for Zithromax suspension, and we dispense the generic version, azithromycin. So the drug you're going to receive today is 200 milligrams per 5 milliliters, or 40 milligrams per mil. Again, the drug is a liquid suspension, and it's going to be given to your son by mouth.
Okay.
Do you have any idea what this medication's for?
He has a middle ear infection, I believe.
Exactly, middle ear infection. All right, so today you're going to receive 15 milliliters of the suspension. You're going to give your son 1 teaspoon today.
Okay.
And then for the next 4 days, you're going to give him half of a teaspoon.
Okay.
All right?
Yeah.
Okay. You're going to be giving him this suspension by mouth, and it's probably best to shake it before you give it to him just to get the drug mixed up well.
Okay.
It will settle to the bottom.
All right.
All right. And you're only going to have to worry about once a day. So
Okay.
That's good. The best way to do it is probably just pick a time, give it to him that time every day. That way he'll never forget.
All right.
You can take it with food.
Awesome.
Or he can take it with food, yeah, or without. It's probably best with food. It'll be best for his stomach.
Okay.
So this medication does have some side effects. The most common ones would be upset stomach, diarrhea, headache, nausea, or lack of appetite.
Okay.
So if you notice any of these in your son, the best thing to do would probably just be call your doctor.
Okay.
All right. He also could have an allergic reaction. This is uncommon. It's not really something you have to worry about too often. But if it does happen, if he has a rash, hives, or red, swollen skin, then the best thing to do would be call your doctor right away, because this could be serious.
All right.
Also, if he has a fever, passes out, be another thing to call the doctor about.
Okay.
So if you forget to give him the drug one day, you can give it to him as soon as you remember.
Okay.
Except if he's close to his next dose, you just skip it. Don't worry about it. So don't give him 2 doses at once.
Okay, gotcha.
Right. And then you just continue as normal until the medication's gone.
Okay.
All right. And there's 0 refills on this, so you're not going to have to worry about coming back here.
Awesome.
All right. So just to make sure I didn't leave out any important information, I was wondering if you could repeat a couple things back to me. So
Yeah.
do you know what medication you're here to pick up today?
Yep, azithromycin.
All right. And do you know how your son's going to be taking it?
Yeah, so he's going to take 1 teaspoon today, and then for the next 4 days, he'll be taking half of a teaspoon, and he can take it whenever, but it would be better with food.
All right. Perfect. And do you know what it's to treat?
His ear infection.
Excellent. So do you have any questions or concerns for me?
I do not.
All right. Well, if you do come up with any questions, feel free to come down to the pharmacy or give us a call. Thanks for your time today. It was very nice talking to you.
Alrighty, thank you so much for your help.
Yeah, have a great afternoon.
You too.